This is the first HREC conference that we know of, at least since probably 2007. That's not to say that conferences such as the Conference of the Australasian Ethics Network and the ABEL Conference aren't ethics conferences, but in 2007, the National Health and Medical Research Council held its last full conference for ethics committee members. And we recognise that there has been a bit of a hiatus there. And in the last couple of years here on the Hurston campus, I've managed to organise conferences of Queensland Ethics Committee chairpeople and deputy chairpeople, but there seems to be an identified need for a conference for Ethics Committee members. So you're most welcome, and in the feedback form that we will provide, we will be seeking your information as to whether or not you are an Ethics Committee member. So although initially this conference was perhaps going to be Queensland specific, it seemed very sensible to have it all across Australia. And as such, as I said, all states and territories are represented to the extent of 800 members. Now, there's a few housekeeping things, and I know you're going to ask these questions, so I might as well get it out of the way now. Will slides be available? To be perfectly honest, this will be up to the presenters. We've offered them the opportunity to have their session recorded and published online on the BDHP website. I can't guarantee they will say yes for reasons of intellectual property, and that is completely fine, and we should always respect that. Should they wish to share that, then we will most happily put it up on the BDHP website for you to look at. And this is particularly relevant to those who would not be able to join us for these couple of days. In terms of timings, the timings have been made to allow you time to go and do your other work in between sessions. Sometimes there's an hour gap, sometimes there's a half an hour gap, but I think it probably beats sitting at a conference for 3 days straight without having the opportunity to do your own work. So in terms of questions, I think what we'll do is we'll probably do them through the chat room. And the reason being that we can monitor the chat room. And as you'll understand, if we have 700 or 800 people online at any one time, it's going to be pretty difficult to see whose hands are up. So if you ask questions through the chat room where possible, and noting that a couple of our sessions will be being provided through recordings, that would be the way to go. So without further ado, I would like to ask Mr. Jeffrey Binge, the Cultural Capability Officer from Royal Brisbane and Women's Hospital, to step forward and do an acknowledgement of country. Jeffrey, over to you.
Thank you, Gordon. Good morning and welcome to the Queensland Human Research Ethics Training Conference here at the Royal Brisbane Women's Hospital campus. My name's Jeffrey Binge. I'm the Cultural Capabilities Officer in the Adult Allied Health Professions Department at the Royal Brisbane Women's Hospital. I'm proud to be here today to contribute to the conference, and as part of Aboriginal and Torres Strait Islander culture and tradition, and as a contribution to the commencement of the conference, I would like to offer this acknowledgement of country.
For many thousands of years, the Turrbal and the Yagara people observed a protocol that respected the land. This traditional acknowledgement was protocol and performed by the traditional custodians to show respect to our ancestors past, acknowledge our ancestors present and our elders who have gone before us. It is important to our culture and tradition. They hold our memories, our traditions, our culture, and their stories sustain our people. Their knowledge lays the foundations for our next generations. The foundations for us to live, hunt, and gather in ways that sustained the communities of people who lived upon this land. To protect and preserve this for now and for times yet to pass. A land of tall eucalypt forest, flowing freshwater creeks, valleys that were our pathways, but by the new settlers called Duke of York's Hollow. These places were rich in bush foods, hunting grounds that we made our homes for many families and communities. We acknowledge these tracks, hunting places and ceremonial grounds. The paths offered safe passage to any visitors who came in peace and respected our land. Following the well-worn tracks to ceremonial grounds where law and customs were decided. So welcome to Bramban country, this land where the Royal Brisbane Hospital now stands is remembered always as Turrbal land. Under the concrete, bricks and roads, this land was and always will be the traditional lands of our people. We pay our respects to our ancestors' great spirits, the creator beings whose actions and efforts made this land. A protocol we have respected and honoured for thousands of years, since time immemorial.
Thank you for taking the time to view the acknowledgement of country. And that particular acknowledgement of country is quite new. It's been specifically produced for the Metro North Hospital Health Services, and particularly the Royal Brisbane Women Hospital campus area and facilities on this campus. In keeping with the University of Queensland and the Royal Brisbane Women's Hospital spirit and commitment to reconciliation, cultural advancement and respect, and my personal respect, I too wish to respectfully acknowledge the traditional owners of this country on whose land we gather to celebrate this conference. I acknowledge and pay my respects to the elders present and to those young people, the future leaders of our community. I acknowledge the elders past, and I'm sure their spirits are here with us today to help us celebrate this event. I acknowledge the presenters who, over the next few days at the conference, will share innovative and exciting, ethical, honest, and proper information that will lead to an upright workplace and community. And in turn, I'm confident that those learnings will benefit Aboriginal and Torres Strait Islander peoples right across Australia. I wish to acknowledge the many attendees at the conference, particularly online, the virtual attendees during the next few days. And I understand from your attendance at this conference that you're interested in human research ethics. And I'm also confident that on any occasion that you work with Aboriginal and Torres Strait Islander peoples, that you'll uphold a virtuous and moral-based approach to your engagement and to your work. Lastly, I'd like to acknowledge the Aboriginal and Torres Strait Islander workers and community members who may be attending this conference. Congratulations on attending the conference and your respective capacity, and to learn and share human research ethics. Thank you very much for listening.
Well, thank you, Jeffrey. That was an awesome introduction, and I too acknowledge the traditional owners of the land on which we meet, the Turrbal and Yagara people, and pay my respect to their elders, past, present, excuse me, and emerging. Now, without further ado, may I ask David Bunker, the Executive Director of Brisbane Diamantina Health Partners, to say a few words for this conference. Thank you, David.
Thanks very much, Gordon. So look, I'd like to welcome everybody to the Queensland Human Research Ethics Training Conference today. This is a really exciting conference, and Brisbane Diamantina Health Partners is just very, very excited and honoured to be able to be part of this. I'd like to also pay my personal respects to elders, laws, customs and creation spirits. And I extend that respect to Aboriginal and Torres Strait Islander people who are here today. And I'd also like to recognise those whose ongoing effort to protect and promote Aboriginal and Torres Strait Islander cultures will leave a lasting legacy for future elders and leaders. So just a few acknowledgements and thank yous to start with, and I must start with Gordon McGurk. It's been such a great effort for Gordon and the organising committee and Sarah Gottliebson from my team to pull this conference together. The registration numbers are outstanding, and my experience over the last 12 months of working with Brisbane Diamantina Health Partners, stakeholders and community has been that this is a really critical topic. During the earlier part of this year, we were doing sessions around COVID and infectious disease and webinars and trying to help keep the communications going. And we'd get good turnout to those sessions, but when we held a session on the passport agreement, we got an amazing response. And I think the number and volume of people that are attending today is testament to how important this area is. So I'd certainly like to acknowledge Gordon, the committee and Sarah. I guess just in terms of a brief introduction for me and to give you some context, I think there is still more we can do to improve the application of ethics and governance in operation across the system that we have here. And BDHP is really committed to supporting this. It's a key plank in our program logic and our program design, the way we go about work. And so there's much more we can do, and we're very keen to be able to be part of that. In particular, I think as Queensland Health continues to progress its digital program, and this would be true for all the other states and territories and the federal government, that as the digitisation of the health system continues and digital research, the role of privacy and ethics is going to and must be key to all of our thoughts and to our actions. So I'd like to congratulate everybody in registering and attending. I hope you get a great couple of days out of this. I'm really excited to be able to participate in as much of the conference as I can, and I have a very keen interest in the consent space, so I'll be watching that with great attention later on today, or actually I think it's up next. Anyway, welcome everybody. Thank you very much to the organisers and have a great conference.
Thank you very much for that, David. And we really appreciate Brisbane Diamantina's support of the conference. Now, what I intended to do was make an acknowledgement and a dedication of this conference to Professor Colin Thompson. And the reason for this is, firstly, Colin has been associated with ethics for a large number of years. And secondly, because Colin has now decided to retire from his involvement, both I think in law and ethics. And of course, when one says retirement, or one automatically assumes that one doesn't retire, one just moves on to something else to do. So what I thought I would do just for the next 5 or so minutes is just give you a bit of a précis of Colin's involvement. And I think recognise that without people such as Colin, on whose shoulders many people have stood, the national statement currently wouldn't be in the same shape as it was, and research ethics in Australia wouldn't be in the same shape as it was. So the national statement, as we know it, started life in 1966, issued by the National Health and Medical Research Council as a statement on human experimentation, which expressly drew on the Helsinki Declaration. In 1972, the Council appointed the Ethics in Clinical Research Subcommittee to examine the need to revise the statement. In 1982, the Council established a Medical Research Ethics Committee to assist the Council by keeping under review and making recommendations to Council on ethical principles in human experimentation and to facilitate or to respond to questions raised by them. The enactment of the National Health and Medical Research Council Act in 1992 saw the establishment of the Australian Health Ethics Committee. And almost contemporaneously, in 1996, there was a report of the role and functioning of institutional ethics committees. Between 96 and 99, HREC, the Australian Health Ethics Committee, developed the guidelines that were contained in the National Statement on Ethical Conduct in Research Involving Humans, the national statement that we know today. So there enter Colin Thompson. Colin was a professor of law at the University of Wollongong, where he was the academic leader for health law and ethics in the Graduate School of Medicine and Health. Between 2002 and 2006, he was a consultant on health ethics for the NHMRC, during which period he provided consulting services to the NHMRC, the New South Wales Department of Health, and the New South Wales Department of Community Services. He was also the chair of the Australian Health Ethics Committee in 2006 to 2009, which is roughly when I joined the NHMRC. He was closely involved in the drafting of the 2007 national statement. But importantly, in terms of ethics review, as we know today, out of the 200 or so ethics committees in Australia, there are 50 or so whose ethical review processes have been certified by the National Health and Medical Research Council as part of the harmonisation of multi-centre ethical review process. Colin was an inaugural member of the assessment team of that, and I had the opportunity to accompany Colin on a number of the assessments, where I believe his methodical and considered approach was used to effect the standards that represent those certified ethics committee today. He has also served as a vice president of the Australian Bioethics Association and chair and executive officer of the Australian and New Zealand Institute of Health Law and Ethics. I think importantly, when we think of ethics committees, we tend to exist in a singularity. But one way to understand the differences between ethics committees, of course, is to sit on a number of them. And Colin managed this. He was a member and chair of 4 human ethics committees since 1984, both in the university space and in the public health sector. Those being the ANU Committee, the ACT Health Committee, the Australian Institute of Health and Welfare Committee, and the University of Wollongong, the CSIRO, and the Department of Health. In 2018, Colin was made a member of the Order of Australia for his service to medical research, particularly research ethics, education, and professional associations. Colin is held in extremely high regard by his colleagues across the research ethics sector in Australia for his major contributions to the development of sensible and responsive regulation and workable ethics guidance in this country. As a result of Colin's efforts, relationships between researchers, reviewers, and regulators in Australia are far healthier than in other parts of the world. Unusually, in a sector where sometimes people gauge their own worth against the research achievements of others, and where we have traced the emergence of an adversarial culture, there is deep personal affection for Colin among many researchers, reviewers, and regulators. He has remained active long after he could have retired and has continued to mentor new generations of researchers, reviewers, and ethics managers. So Colin, I'm not sure if you're listening. I did speak with Colin the other day, and of course he was somewhat embarrassed that I would even consider dedicating a conference to him. But I felt that since he was the chair of the last conference organising committee in 2007, and with his retirement, it seemed an appropriate thing to do. So Colin, we're very grateful for your leadership in the field of research ethics in Australia, and wish you all the best in the next chapter of your career, noting that, as I said, one never really retires, but in fact, just finds something else to do. So Colin, I hope you're not too embarrassed by that, but if you are, that's kind of tough. Okay, well, look, we're a bit ahead of schedule, but that's fine. Our next speaker, our first speaker, in fact, wasn't able to be live, and we had we did manage to record it this morning at some ridiculous time. And thank you for the virtual applause there for Colin. I think that's important that we all recognise Colin's contribution. So what I might do is I might just flick to our programme first of all, so I can. There we go. Okay, so we've. The first session will be the plenary session. The programme is as advertised, and the timings will largely be as advertised. Of course, if we start a bit early now, then we'll finish early. You can see that the programme, at least day one of the programme, is largely around issues of consent. And of course, in the afternoon, Andrea Kalea from Salinger will be presenting on privacy. The issues of consent, to me, as a chair of two ethics committees, both the Royal Brisbane and Women's Ethics Committee and the University of Queensland Ethics Committee A, is one of the cornerstones of any decisions that we make. I believe that getting the consent process right, as well as using data and understanding the legislation and the rules around the use of data, are probably two of the key things that ethics committees have to deal with in this modern age. Now, David Bunker was the chair of the Queensland Genomics Association, QGHA, Health Alliance, my apologies, Queensland Genomics Health Alliance. And these days, when much of the research that at least comes to a hospital committee deals with genomic material, so blood and tissue samples, it's quite crucial that we are able to use it in a manner that both respects those who have donated that tissue, but also in a way that we manage their data. So today is really about consent, and we'll hear both from Ian Freckleton and Christy Geddes about obtaining consent in situations where there isn't capacity of the participant to freely give that consent themselves. And I think these are key issues. Later on in the day, Tanya Simons will be talking about recognising the consent process in human research. And Tanya has been working on a number of projects, one of which is about simplifying the participant information and consent form. And so I asked Tanya to see if she could reimagine the process. And I believe that Tanya, while both doing her PhD and working with the New South Wales Department of Health, is doing just that. Later on, we will hear from Nick Zepps, the Director of Research at Epworth Hospital in Melbourne, about the use of e-consent. Okay, so the time now.